Multisensory instruction has a lot of different meanings, and it's very difficult for people to specify what it means. In the older versions of reading interventions, like Fernald, for example, and some of the early versions of what are now called Orton-Gillingham approaches to teaching, what it meant is teaching to all the senses, teaching to the auditory modality, to the visual modality, and to the tactile modality. To the degree that that type of instruction has been added onto what are called structured literacy interventions, there's not much experimental evidence that shows that that type of instruction is really important. In contemporary Orton-Gillingham approaches, for example, they may have a multisensory component, but they also have a structured literacy component that teaches phonics, basically. And that component is very important. The multisensory component, as traditionally defined, does not appear to be effective, and it doesn't seem to be important for children, specifically for children with dyslexia. It's probably better to think about multisensory as representing multiple modalities, so that the child sees a word, says a word, writes a word, uses multiple modalities, not sensory modalities, but just different modalities to reinforce learning. That's a much better definition, and it's a characteristic of many good instructional programs. If we restrict instructional programs for children with dyslexia to what are called Orton-Gillingham or structured literacy or multisensory programs, many children are not going to respond just to those programs, and we need a broad array of appropriate reading programs for children to receive intervention.